Awesome.
Hey, and we're back to the after show. I hope everybody was there for our regular podcast for healthcare quality risk matters, where we were talking about planning and why the quality team needs to have a seat at the table now. And so now we're hitting into the after show. In the after show, guys, we are looking at, talking about higher quality, lower risk, greater insights, really driving through and picking apart the topics of the month, and letting our hair down, lifting up the kimono, and all those other acronyms and analogies you can throw at it to talk about the topics of the day. We're still talking about planning, and we after the show, guys, we have been just the three of us stunned that somebody would go 8 years and not correct the problem and end up with a hospital being closed. And I don't know where to begin. Timothy, I think a great place to be start with you. Let's talk about the people that were impacted
Yeah,
by this.
we're talking about God. When you think about the people side, there's two different perspectives I look at. Your employees, which is kind of like your family, the ones that are doing the work for the community. You let them down. Let's be honest. If a hospital shuts down due to an error this major and having this much time to correct it, and there was no steps put into place, there was nothing to mitigate this overall issue and risk, and that the ultimate demise of the organization is because didn't have a plan. You have essentially let down each one of those employees for their overall organization, and it's just heartbreaking to know in a time where it's already difficult to find jobs. We have job shortages all over the U.S., especially healthcare workers. I'm starting to see a major push and changes of healthcare employees being let go and different things of that nature, and departments merging and shutting down. This is just completely heartbreaking to see and hear for this overall healthcare system. I don't know the intricate details of what was going on for, as far as culture for the organization, but for me, if I were working for this organization, I would almost say, yeah, it's one of those situations where you would almost take it off your resume because it's that heartbreaking enough to even just say, I can't believe it happened. The other side to this is the patient aspect, and I mentioned this earlier in the podcast. Think about the patients that don't have transportation to a hospital. They rely on the overall emergency care services to be able to get them from their home to the overall hospital and back and things of that nature. You have now essentially taken away their ability to get emergency care in that overall community. So we don't know how far the next hospital is or how close,
It's
but
really
when you,
inexcusable. You really think about
yeah,
it, it's
it really
inexcusable.
isn't inexcusable. And it's just it's a heartbreaking situation for both the
Yeah,
employee and the patient involved.
yeah. Rob,
Mhm.
let's talk about, well, let's just say it. How stupid can they be? I mean, we talked about ego in the show. This is beyond ego. I mean, this is absolutely moronic to allow 8 years to go by without making a change.
For 8 years to go by and you to fail because you did not do the right things to respond to an event that happened, which sounds so simple, right? Just do the right things. And
Mhm.
now it's
And how big of a deal would have it been? I mean, how
it,
much disruption really would it have been?
I just looked them up and they're not big. So it hurt. There's no way it didn't hurt, but hurts happen.
Mhm.
And if you have the right controls and systems and processes in place, you could have prevented it. And I see that it's a
Mhm.
critical access hospital. So my brain tells me that likely there's not another hospital really close.
Yeah.
Mhm.
And I don't know that. Again, we don't have all the specs yet or anything like that, and some of it's locked down. We don't know, but there's all of those people, like Timothy's saying, are actually in danger. I mean, they're going to have delayed care. Your cardiac, there's patients, your stroke patients, those patients that have these golden numbers that say whether you're going to survive. There's are now at risk of not meeting that golden mark, right?
Right.
And they're going to die, and that's crazy
Mhm.
and insane that they didn't put the right controls in place. They should have engaged the FCC, implemented smart internal systems. That would have distributed that injury, right? That $25 million injury. There's over time. They should have mitigated risk. There's increased quality to ensure that billing was at its max. Patient care, patient continuity of care was maxed out for the benefit of the patient and the financial health of the organization. And my mind already races about hundreds of mitigation strategies to ensure that they did not have to close and jeopardize that community. And I can only assume they had 8 years that they didn't do any of that or do any of it well.
For you guys who've tuned in to the after show here on YouTube, and you missed the podcast, what we're talking about is our incident of the month this month, where a hospital in Ohio was given a warning. And Rob, you had talked about they were violating, what is the rule again?
It looks like the anti-kickback
and the anti-kickback type rules, which may have been, not intentional, but they were caught on it, and they needed to correct those procedures and properly document certain things and put corrective actions in place so that they would not happen. 8 years later, no change at all. Regulators came in and said, this is an unreliable hospital, cannot be trusted, shut the whole place down. And that's why we're so fired up, everybody, is it's inexcusable. And, when we think of healthcare quality and risk, we at AperiSoft Healthcare have devoted ourselves to developing software that will integrate all the very aspects that are necessary to make this happen and make it affordable to a hospital. So from our vantage point, you can understand our emotion. One phone call, we could have saved this hospital. Not only saved them from being shut down, we could have helped them grow, become better, become a more dynamic hospital in their community. And it's all a matter of just doing the right thing.
Yeah.
The right thing.
I fully believe. Sorry, go ahead, Timothy.
No, I was going to add just one point to that, and not adding any FTEs to the organization, just utilizing the people that are there with our team, to really focus in and identify the key issues that need to be corrected, and showing them step by step how to make those changes. I don't understand how.
And then you're documenting your corrective action. So when the officer comes back and say, "Are you doing anything about it?" Yes, I am. This is what we're doing. Here's where we are in this project. Here's where we are in that project. We should have this one wrapped up in another month. This one's going to take a little longer because we have more details we have to work through in the organization, whatever. But, now the auditor walks away knowing that you're taking action. To correct the problem. It's available. We're here. We can make a change in your hospital as well. But let's keep digging into the planning at the table thing, Rob, if you don't mind. Let's dive into that topic some more.
Yeah, if I walk into a hospital and you say, "Hey, I have reached out to AperiSoft Healthcare because we need help," there's the first thing I'm going to ask is there's to see your strategic plan, and I want to talk to your executive team. I want to know what the organization is doing. There's to mitigate any other risks, because you can't afford there's other risks. You can't afford a cost of poor quality. You can't lose 15% of your revenue when you're already losing half of it. There's to fines, sanctions, there's you name it. So you have to improve your system of quality. That will be day one, job one. And if you're not willing to engage, you're not going to be successful. You're just not. So you need to let us implement really intelligent systems like AperiSoft Healthcare. We need to start having strong controls from the ground up. The person who is hired today needs the same level of structure around quality improvement and risk management and compliance management. As the person who's been here for 35 years and running the hospital. And implementing software would be really important. So sitting down at the table with them, say, to Timothy's point, not asking for an FTE. FTEs are risk, right? FTEs are risky. But technology is not as risky as an FTE. It does way more than one FTE.
Right. And let's work back from that planning table, right? The seat at the table. And then let's kind of work backwards from there a little bit. So let me frame it, and you guys please dive in, and hopefully I'll stimulate some thought. First of all, when you have a system in place like AperiSoft Healthcare, you have all of the key information available at any given time. You have an overall quality barometer that's telling you how you're doing overall in your hospital. You're able to go and look at the corrective action plans, see their immediate status at any given time. You can make sure that all of your policies, procedures are up to date and are there and within the system. You can track your current audit findings and where they are in progress of response. You can do a proactive risk assessment to bring to that strategy table to help to direct what that plan may look like. You can do internal pre-audit audits of yourself against any of the standards that may exist in advance of an auditor coming in, so you're prepared. You can be prepared for all of this, all in one system. Now, I know that software is not supposed to be a silver bullet, guys, but if I'm an executive and I'm trying to manage my hospital, why would I not want to have all of that capability right in front of me through one source? And besides that, let's go further. When we do business with them, it's not, here's the software, we'll train you on it, and then we're gone. We're bringing experts like Rob Santamore, experts like Timothy Brown to the table to help you best deploy such software and then improve your processes as well, so you start getting gains and value out of it. It just keeps piling on why they need to do this. So if you're at the planning table, Rob, and you've got nothing, or you've got disparate systems, and I'm going to assume that the hospital in Ohio didn't even have, they're probably in Excel spreadsheets for all we know.
If that,
it didn't sound like they had much. Bad things still keep happening. And what we're trying to do is to plug that gap. Guys, where am I wrong in my thinking with this?
Not even a little.
No, you're not wrong at all.
Everything that you mentioned, would be a mechanism and control to prevent them from getting shut down from that initial fire. It could have prevented that initial fine. You talked about the fact that there was document control, that there was incident management, that there was CAPA management, that there was auditing. There's my brain immediately. Without getting too far in the weeds, I will try. There's awesome. I have wonderful centralized document control. And I would have clear policies and distribution of said policies. There's that say, here's my corporate compliance policy, my code of conduct. There's my BAA with the referral lab, along with there's the vendor qualification and associated education. Awesome. That's going to cover all of the education that I did with everybody. There's on anti-kickback laws and fraud and how to document those things and how to assess those things. Then I have an internal audit process that outlines, there's all of those standards that actually are really clear. There's in black and white, there's with the requirement for objective evidence right in the system. I am saying, yes, we are compliant, and I have an assessment point, or no, we're not compliant, we need to fix this tomorrow, like immediately. And then you have your dashboarding and CAPA management to fix any of those things, right? And then the dashboards for oversight. So you can watch as the CEO, there's what is happening in your organization today, tomorrow, and what happened 6 months ago, and predict what's going to happen in 9 months.
Yep.
So it gives you all of the tools that you would need to stop this community from being without healthcare. If you would have brought quality to the table, there's implemented an intelligent program with expert advice. I truly do not think they would have shut down. I don't think they would have had a finding in the first place.
I'll hold that thought because I have an idea of what we might want to continue to pull a thread on here in a minute. Timothy, you were going to add to that.
I was actually, there's two areas that I wanted to kind of hint at what Rob was talking about: training, identifying what training employees or anyone has had in the organization. That's going to be your foundation. Beyond that, retraining or adding additional training to identify where your overall gaps are. But there's one area that I think he really mentioned too that I like to pull from, Gary, you kind of hinted at this earlier as well. It's that data-driven decision making. We can't make any decisions unless we have clean data. I heard one leader say, "Clean in, clean out. Clean data in, clean data out." That way, we can identify what those overall true risks are for your organization. If you don't have a system that can tell you what's going on, what's going right, what's going wrong, what could be improved, then that's where you're essentially bleeding, if you want to call it, or
Right.
hemorrhaging from. It's trying to put a band-aid on an open cut or something like that that's just openly bleeding for your organization. What data are you able to assess from your system? If you have disparate systems and they don't communicate well with each other, how is that affecting your overall process improvement? For your leadership team, if they don't have up-to-date data where you have real-time stats where you can look at individual departments that are hotspots if you're for your organization, you can't identify that quickly and put a plan in place for that, then you're working with probably a dated system that, especially if it's Excel worksheets, you're working with a dated system that's going to cause issues similar to this. One more thing that I do want to highlight from what you said, Gary, it's not like this overall organization received the warning and then within the next quarter they were shut down. We're looking at an 8-year span of
I
time.
know.
So
That's just. I mean,
it blows
I'm
my
thinking,
mind.
where was I 8 years ago? You know what I mean?
Seriously. I mean, even if you had turnover every year, you had enough time to be able to put someone in place or a system in place to correct it.
Yeah.
So there really is no excuse for this organization being shut down.
Yeah. Let's pull a thread, guys.
Mhm.
We're experts in Aperisoft healthcare, but you guys are the real experts in healthcare. And I'm sitting here thinking about, I'm an expert in the software. I'm sitting at the C-suite table. It's reported to me that we just had a really bad audit. We got hit pretty hard. It's a significant situation that must be corrected. What would have happened if Aperisoft healthcare was already in place? I'd be turning to my chief risk officer, which I think they should have, and I'd say, well, what happened? What's the situation? They would be able to come back to me right away and say the audit finding was X. We then took that audit finding and we did some additional analysis on our own and have identified 3, 4, 5, whatever the root causes were. And we've created the following 5 corrective action plans that are now being monitored in the system. I'll be able to come back to you on a monthly basis and report the progress. That would have been the conversation. The auditor would return. Yeah. And the auditor would have returned what? In a month, 3 months after an audit like that?
Depending on what kind of audit. So a fraud, there's claim would go to the Department of Justice, and you'd likely have to pay that one out. There's anyway, but it's all the subsequent. There's audits that if that didn't shut them down that day, they had 8 years to fix it. To your point,
Yeah.
You're right. There's first thing you said, they were hit hard, but what are we doing? We're capturing every other cost of quality.
Yeah.
And we are making sure that it doesn't cost us anything. We want quality to retain our revenue, to help boost our revenue. There's through higher performance, right? And greater engagement. There's with our payers or whatnot, right? But my gut also says, why don't they have it in the first place, right? Why are we using there's such clean data in, clean data out? Why are we using such gross data?
Yeah.
And so they didn't have decision making.
Most likely, if they had Aperisoft, he would have all the right things in place and they've been properly trained. And
they would have never had the problem.
But let's just assume that we came in late. Right?
Yeah.
We came in late. This happens. I'm going to guess is that the auditors return a month away or whatever DOJ arrives. Yeah. First thing they're going to ask is, what are you doing about it?
What are you doing about
it?
Right? and now they can say, well, we've got Aperisoft healthcare in place now, and we have analyzed it. I can show you our analysis. Here are the corrective action plans we have put in place to remediate this problem going forward. The auditor is going to say, great, I'll be back in a month to check on your progress.
Yep. And then I, as the quality person, would immediately be on the phone with the FCC. And because I'm worried that my building's going to get shut down. And because that's hefty, right? and I'm going to say, here's what I'm doing. I'm going to get on the phone. There's any potential like savior grant or whatnot. And I'm going to start researching and using my newfound intelligent process. There's as my leverage. There's to say,
Right.
I promise it's not going to happen again. Here's how we're controlling them.
Yep.
I do think that it could have saved them. I really, really believe that.
Now
But
let's
you
look
know,
at
Rob, to that point.
I'm sorry. Go ahead.
No, just to say to that point of the promise that we won't do it again, it's given a clear proactive approach to how you're going to mitigate that issue. If you can show them that you're actually actively working towards making it better and you show the steps of how you're going to move through it. A lot of times when you're hit with those overall audits and things of that nature, they're people too. So they understand that shutting down a hospital in a community is detrimental to everyone around it. So if you show that plan of what you're doing and you're actively working toward those steps, like you said, this could have been prevented. And within 8 years, my God, come on. It just completely blows my mind. So sorry, Gary, go back to your point.
Well, I was saying, Timothy, turn it around to the planning side now. All right, you've got a parity soft in place, and it's a brand new strategic plan. What is the information now coming to the table that we know about this incident, right? It's been documented. We've got things in place. How is that newly appointed chief risk officer we're talking about take what they have in place with the parity soft to start driving planning from that one angle? So I'll let you both get a chance to respond to that.
Sure.
How are they leveraging the tool?
That risk officer is going to utilize and take the information out of the parity soft system, and they're going to help the executive team establish a clear, measurable objective that aligns with both all of their clinical quality, their patient safety, and also risk management. And using the data that they can pull, like we said, that data-driven decision making, to create what we would call a broader organizational priorities for the organization. So identifying those key top 3 or 4 issues that align with the mission, vision, and values of that organization to ensure that they're moving in the right direction. You can also work around financial stability and growth within that overall conversation as well. But it really is identifying those 3 to 5 steps that need to be taken within the next 90 days, 30, 60, 90 days, 6 months, year, 3-year and 5-year plan for the organization. And all of that can be done with the information that you can pull right from the parity soft system.
So how is the parity soft doing that, Rob?
So there's one, to repeat everything that Timothy just said. Yeah, the SWOT analysis that I talked about, like you have a packet, right? Because you need that. But handing it over in a stack of papers that I rented a conference room out, a 20-foot table, and I can't fit all my papers to organize it on, doesn't make sense. In Parasoft, you can go to the dashboard, and I just bring up the dashboard and I have my SWOT analysis. I can see where my weaknesses are drilled right down. There's to the unit level, or even more granular. There's, if you want, and you can drill it down to a physician group, right? You can say, here's a physician group or a referral lab, or you can get as granular as you want. And I know where all of my weaknesses, and I also know where my strengths are. And I see that somehow there's my ICU has no incidents, no concerns. There's high functioning on all my critical drips, but yet everything in the ER failing on all my critical drips. Cool. I know my weakness and I know my strength. So let's squish those together and bring up the weaknesses with our strengths, right? I have a very intelligent plan with my dashboard on how to allocate my resources, including my time and my money and my people. There's throughout my entire organization, there's my entire year's focus. There's by literally clicking one button and then scrolling, right?
Yeah, and it's interesting too. And I think, for the C-suite folks who might be listening to the after show, or for those who are going to be recommending to their C-suite to the after show, where you're going to see in a Parity Soft Healthcare Edition, I'm not going to see anywhere else, is that we can give you 2 scores. One is a quality score, and that quality score is going to be looking at actual incidents, because it's built on your incident tracking system, where not only are you going to be able to document those incidents, but now every incident is going to be reviewed from the lens of a quality risk perspective and create a quality score at the time the incident was reported. Then, when you do your corrective action planning, you're going to be able to build on or buy back quality points for the actions that you're taking, where that original score can then be going up as you're completing those action plans. On the other hand, when I'm looking at audit or risk assessment, whatever, you have a risk score that can be aggregated into an overall risk score from that side. So we want to keep that low. We want to keep the quality score high. We make those two things happen, we've got a humming hospital. So now if I'm in the C-suite, right, Rob, I'm looking at you and you're my chief risk officer, and I'm saying, okay, well, why is our quality score at 80? What do we need to do to get it up to 90?
Let me just scroll for you, Gary, and I will
There you
help
go.
you identify those risks.
There
and
you go.
I love what you said. I'm going to steal it from you, just so you know, about buying back your quality. There's because, yes, I actually just had a conversation last week with one of our clients. Who said it already happened. We can't make it better. So not true. Absolutely not true. There's mistakes being made can be a huge benefit to you. There's one, it identifies potential risks. There's which improve your quality if you act appropriately.
That's correct.
But two, it proves the effectiveness of your quality program. Every accrediting body's main focus when they come in is how you manage your operations through the lens of quality, risk, and compliance. That is every accrediting body, whether DNB, JCO, doesn't matter. That is their core function. And they're going to say, awesome, your event log is massive, fantastic. You reported 4,000 of these, and we would have only expected you to report 2. You guys are doing a really good job, because also look at the mitigation strategies you put in, the quality improvements that you have made. You guys are great at internal quality management. That speaks volumes to who you are.
Yeah.
So I love the buying back your quality, because you can actually see you buying it back in a PeriSoft Healthcare.
Or buy down risk, right? You're buying up quality or you're buying down risk. And that's the beauty of what we've accomplished, I think, guys, from a tool perspective. Is like you said, sure, let me click in. You bring your laptop into the meeting with the CEO and you clip in and say, well, here are the top action plans that are in place. Once we get these done, our quality score will be up to whatever, and okay, good, thanks. Come back, let me know how the progress is going. I mean, it's not a mystery. Everything is right there and at your fingertips. Audits should go quickly.
Yes.
They should much lower in terms of impact. So all those fines and so forth that organizations are having to pay now, they're going to start to shrink. The amount other ancillary costs are going to start coming down. There will be a new normal, where we're talking 15% of our revenue is cost of quality. With the PeriSoft Healthcare, there's a new normal.
Absolutely.
It's going to shrink. So, Timothy, you had the last word in the podcast today. We'll give you the last word in the after show.
I will definitely take the last word. If we go back through and just kind of summarize where we're going, this particular incident, where we come from and where we're going, this particular incident in Ohio could have been prevented. And we're not just talking about the overall 8 years. We're talking about from a strategic planning standpoint of your leadership team, incorporating your quality leader, giving the ability to have data-driven decision making. And then, Rob, you kind of hinted at this a little bit earlier too. A continuous improvement culture is really what's going to be needed as you're moving forward. Having a system like a PeriSoft allows you to be able to identify those key risks, not only previous or prior risks, but those that are currently going on for your organization. It allows you to track the overall corrective action plans and also helps you buy down the overall risk, or as we said, pay it for the overall quality for your organization by being able to identify the costs that are associated with each individual risk, both individually and collectively for each department and throughout your overall organization. If you're looking at it, if we're looking at that ability to provide that continuous improvement, if we're looking at promoting that culture through If you want, we kind of spoke on this last month as well. High reliability organization principles and patient-centered care initiatives. And the way we do that is identifying those overall risks within our system, sharing that information with your executive team, but not only the information, but the plan to move forward strategically for you. And there's multiple ways and avenues that we can do that, but it all requires first an initial phone call to understand how we can help and improve your overall quality for your organization.
Exactly. Well, folks, that's our after show. I want to thank you for joining us today, and we certainly want to invite you to join us next month. We'll be recording these after shows after each podcast. We're hoping these after shows are going to get you some deeper insights into the topics of each month. So next month, we're going to be looking at the cost of quality. I think you're going to want to tune in not only to the podcast, but also to our after show where we'll really peel that apart. Again, thank you for joining us. We look forward to seeing you on the show next month. See you then.